If you ask most men if they want to be bald, most are going to say no. But if you're on hormone therapy, your hair might not have gotten the memo. Testosterone replacement therapy, or TRT for short, can put hair loss into overdrive. But that's only if you have a genetic predisposition to losing your hair in the first place. If you're experiencing accelerated hair loss, you don't care about genetic. You're freaking out because you're constantly seeing more hair in the sink and less on your head. You want a solution. So let's talk about options. You could quit TRT, but that's not likely. You could shave your head and pretend it was on purpose. Some can pull it off, some can't. Or how about this? You could stop shedding and maybe even put some of that hair from the sink back on your head. So that last option, the one about not shedding anymore, it could be possible with a product called finasteride,
aka Propecia, and it's a prescription pill that helps fight hair loss by reducing DHT. And DHT is short for dihydrotestosterone, the same stuff responsible for deeper voices, body hair, muscle mass, fat distribution, and yes, even your sex organs.
And if you want to see how much DHT you have, just look down, pull out the waistband of your shorts, and if you have to squint to see something, you were not blessed with an abundance of DHT. Oh, stop searching for your cheaters. I was just joking. But DHT is the issue though. And when you have too much of it, it starts bullying your hair follicles. But let's take a step back for a second and talk about how hair actually grows. Hair grows from follicles that go through a cycle lasting anywhere from 2 to 6 years. And then they take a break and the cycle restarts. But when DHT latches onto those follicles, it shrinks them, weakens hair, thins it out, and eventually it stops growing. Your follicles get lazy, or worse, they quit. Finasteride blocks testosterone from converting into excess DHT. Less DHT, smaller bully. You take it daily, and the results don't happen overnight. It usually takes 3 months or more to see results. And if you don't stick with it, you start to lose the progress you've made. So it's something you're going to have to kind of keep doing, or you're going to lose the gains. You need proof? 2-year clinical study showed 66% of men on finasteride saw visible regrowth on the crown, and only 7% of those on the placebo saw the same thing. Finasteride has also been used to shrink enlarged prostate.
Here, let me show you.
Which means it can lower PSA test results. And it's not for women or kids at all. Pregnant women shouldn't even touch the stuff because it can be absorbed. What in the hell is the matter with you? Are there side effects? Of course there are. Swollen hands or feet, dizziness, rat. And the one no guy wants to ever hear, sexual side effects. But most guys, no issue. Just something to be aware of. It's just something that has to go on the side of the bottle to mitigate their legal repercussions. So, should you consider finasteride? I would say if your hairline's backing up while your T levels climb, yeah, it's worth the conversation. And Viking Alternative Medicine prescribes it for those who qualify. But the point is, losing your hair may not be something you just have to deal with in order to stay on hormone therapy. And if you're worried about it, talk to our licensed medical staff to see if you're a candidate, because getting old is inevitable. But feeling old and looking old, that's a choice.